about the beta-lactam antibiotics. Now we come to the other group of drugs, which are the tetracyclines, chloramphenicol, and the aminoglycoside antibiotics. Now, tetracyclines and chloramphenicol are included under the broad spectrum antibiotics because they act on a large group of organisms, and therefore the name broad spectrum. Okay, so they are included under the broad spectrum antibiotics. Now, first we'll see the tetracyclines. Now, the tetracyclines have a nucleus of 4 cyclic rings. This nucleus, which consists of 4 cyclic rings, therefore the name tetracyclines. Now, the various drugs which are classified under the tetracyclines are tetracycline, then we have oxytetracycline, then we have demiclocycline, we have doxycycline, we have minocycline. So all these are classified under the tetracyclines group of antibiotics. Coming to the mechanism of action of these drugs are having a bacteriostatic action, and they act by inhibiting the bacterial protein synthesis by binding to the 30S ribosomal subunit. So that is how these drugs are acting. Coming to the adverse effects. Now, adverse effects of these drugs, tetracycline, they are dose dependent. If the dose increases, they could cause damage to the liver. There could be kidney damage. Now, there is an entity which is called as Fanconi syndrome, which occurs with the use of outdated tetracycline tablets. So, the use of expired tetracycline tablets should be avoided. Then phototoxicity again, which is a side effect related to the tetracyclines, which could occur with certain drugs like demiclocycline, doxycycline. So the person should be asked not to go out into the sun after taking these drugs. Then these drugs are having chelating property, and therefore they have side effects on the bones and the teeth. These chelate which is formed gets deposited in the bones and the teeth. Now, if taken in pregnancy, lactation, and in children, these drugs, these tetracyclines, the chelate will get deposited in the teeth. The teeth become yellow in color, orange in color, and these are ill-formed teeth which are easily susceptible to caries. Then on the bones, these chelates will get deposited and will inhibit the growth of the children. So again, in children, of course, this side effect is there. Then these drugs also cause superinfection. So again, these drugs should be used for a short period, and once the infection is treated, these drugs should be stopped immediately. Otherwise, chances of superinfection are quite high with these drugs as such. Contraindications, these drugs, that is the tetracyclines, they are contraindicated in pregnancy, lactation, and children. Uses, they could be used, they are used in orodental infections. Of course, we prefer doxycycline in orodental infections. The general medical uses of these drugs are in case of venereal diseases like lymphogranuloma venerum, granuloma inguinal, and also in case of rickettsial infections like typhus. So these are the major indications of these tetracyclines as such. The other uses, these drugs are used as adjuvants in case of amoebiasis as well as in malaria, but this drug is used in case of chloroquine resistant malaria. Also, this is the drug which is used in acne. So these are the uses of the tetracyclines as such. Tetracyclines, generally full question will not be asked, short note could be asked on tetracyclines about the side effects. Side effects are more important, that is the effects of tetracyclines on the teeth, which is more important for you all. Now coming to chloramphenicol. Chloramphenicol, this drug is again classified under the broad spectrum antibiotics because it acts on a large group of organisms. So This drug comes under the broad spectrum antibiotics. Mechanism is again similar to the tetracyclines. It acts by inhibiting the bacterial protein synthesis by binding to the 50S ribosomal subunit. It is having a bacteriostatic action just like tetracyclines. However, it mainly acts on the Salmonella group of organisms. So the activity is mainly on the Salmonella group of organisms. Adverse effects are very important. They are the major side effects. It causes bone marrow depression, which is a serious side effect related to chloramphenicol. Why this drug is not preferred nowadays, it could cause a plastic anemia, a granulocytosis, thrombocytopenia, or pancytopenia. So this is a serious side effect related to this drug. Again, it could cause it causes gray baby syndrome when given to premature infants. So it was earlier given in premature infants, which caused the death of the baby. So these drugs are again not preferred in premature infants nowadays. Uses of chloramphenicol, these drugs are hardly used in dentistry nowadays. Of course, earlier it was used in typhoid fever, but nowadays again better drugs which are available with lesser side effects. So this drug again is not preferred in case of typhoid fever. Topically, of course, this drug is used in ocular conditions like conjunctivitis and also in conditions like otitis externa. So these are the uses of this drug chloramphenicol. Now coming to the aminoglycoside antibiotics. Now these drugs are seldom used in dentistry. The common properties, uh, they are not used or seldom used in dentistry, but of course you should be knowing about these drugs. We'll go through these drugs very fast. Common properties could be asked for you all. They are available as sulfate salts. These drugs, you could be asked about the side effects related to these drugs and the common properties which are related to these drugs. So these drugs are available as sulfate salts. They do not penetrate the brain or the CSF. They are having a bactericidal action, and they act on the gram negative bacilli. They interfere with the bacterial protein synthesis, and they have got a narrow margin of safety. And also they are ototoxic as well as nephrotoxic. So this, because of these side effects again which are related to these drugs are hardly preferred nowadays. They are classified into systemic aminoglycosides and topical aminoglycosides. Systemic aminoglycosides, we have streptomycin, gentamicin, kanamycin, tobramycin, amikacin, sisomycin, and netilmycin. Topical aminoglycosides, we have neomycin and pramycetin. Now, these drugs, topical aminoglycosides, are too toxic to be used systemically, and therefore they are not used systemically. Now, these drugs, as we have seen, they act by inhibiting the bacterial protein synthesis. They are having a cidal action. They have shared toxicities, that is, the toxicities are similar to all the drugs in this group. That is, they have got a ototoxic potential, nephrotoxic potential, and they cause neuromuscular blockage. Toxicity is very important with these drugs, and of course, these drugs should not be combined with the other ototoxic as well as nephrotoxic drugs. Again, this has to be kept in mind, and therefore you should be knowing about the toxicity part of these drugs. Now coming to the macrolide antibiotics. So macrolide antibiotics, we have erythromycin, which is the prototype drug over here. There are certain limitations of erythromycin. That is, they have a narrow spectrum. They cause gastric irritation. They gastric acid lability is there with this drug. Therefore, these drugs are used as enteric coated tablets. Then less of bioavailability is there with these drugs, and they have a short half-life. Now these limitations, to overcome these limitations, the newer drugs have been developed, that is the semi-synthetic macrolides like roxithromycin, clarithromycin, and azithromycin. So these are the newer drugs which overcome the limitations of erythromycin. Now, erythromycin is having a bacteriostatic action at low concentrations, whereas there is a cidal action at high concentrations. It also acts by inhibiting the bacterial protein synthesis, and again, it is having a narrow spectrum, mainly acting on the gram positive organisms, and it is also an enzyme inhibitor. These are some of the features of erythromycin. Uses, coming to the uses of erythromycin, it is preferred in dental infections where the patients may be allergic to penicillins, or in case of penicillin resistant infections. In such cases, these this erythromycin is generally used in dental infections, orodental infections. It is also used prophylactically as an alternative to penicillins. So again, prophylactic uses also are there in dentistry with this drug. General medical uses are there of this drug. This drug is used as a substitute to the penicillin. So wherever the organisms are sensitive to penicillins, in such cases you can use erythromycin. Coming to roxithromycin, this is long-acting drug. Indications are similar to that of erythromycin. Clarithromycin, coming to the uses of this drug, clarithromycin, it is used in respiratory tract infections, orodental infections. It is used as one of the drugs in the triple drug regimen uh, for the treatment of H. pylori, for the treatment of peptic ulcer due to H. pylori. In AIDS patients due to Mycobacterium avium complex. So again, in AIDS patients, this Mycobacterium avium complex, this is the drug of choice. It is one of the drugs in the combination therapy. Again, it is useful in atypical mycobacterial diseases as well as in leprosy. It is the second line drug, erythromycin. Now coming to azithromycin, this drug is having a longer half-life and can be used as a once a day daily dosing. So that is the most important advantage of azithromycin. The uses of azithromycin, it is used in orodental infections and the other indications which are similar to erythromycin. The dosage of azithromycin is 500 milligram OD for a period of 5 days. Side effects are mild GI upset, dizziness, headache. So these are the uh, features of azithromycin. Now coming to the anti-tubercular drugs. Now anti-tubercular drugs are classified